Hello guys, welcome back to my channel. Welcome to the second trimester. 14 weeks pregnant marks a lot of changes. You might be feeling less nauseated, hungrier and more energetic. Starting with pregnancy 14 weeks, the second trimester is the time to get some exercise. Let's see the weight and size changes in the baby and pregnancy symptoms week by week in the second trimester. The link for the first trimester video is provided in the description. But before that, let's see the ideal weight gain for pregnant ladies. Here is what the American College of Obstetricians and Gynecologists recommend. If you are underweight or BMI under 18.5, your recommended total pregnancy weight gain is 28 to 40 pounds. In the second and third trimesters, aim to gain about 1 to 1.3 pounds per week. If you are of normal weight or BMI of 18.5 to 24.9, your recommended total pregnancy weight gain is 25 to 35 pounds. In the second and third trimester, aim to gain about a pound or a little less per week. If you are overweight or BMI of 25 to 29.9, your recommended total pregnancy weight gain is 15 to 25 pounds. In the second and third trimesters, aim to gain about 0.5 to 0.7 pounds per week. If you are obese or BMI of 30 and above, your recommended total pregnancy weight gain is 11 to 20 pounds. In the second and third trimester, aim to gain about 0.4 to 0.6 pounds per week. If you are pregnant with twins and with normal BMI, your recommended total pregnancy weight gain is 37 to 54 pounds. In the first half of the pregnancy, aim to gain about 1 pound per week. In the second half, gain a little over a pound per week. At 14 weeks pregnant, baby is as big as a peach, measuring 3.4 inches and weighing at 1.5 ounces. Baby has almost doubled in weight in the last week. Symptoms of 14 weeks pregnant. At 14 weeks pregnant, symptoms you felt in the first trimester might be fading. Here are some new pregnancy symptoms you may be feeling at 14 weeks. Round ligament pain. You are probably feeling some aches and pains as your muscles and ligaments stretch to accommodate your growing baby. At 14 weeks pregnant, cramps are often because of your round ligament pain. Increased energy. Increased appetite. Once morning sickness starts to go away, you might find your appetite in overdrive. Remember that what you eat is fueling your baby's rapid growth. You should aim to eat about 300 extra calories per day. Thicker, shinier hair. You might notice your hair getting thicker and shinier. If you found yourself skipping away from the exercises during the first trimester, now that you have your energy back and it's time to get back on the track, consider taking a prenatal yoga class or simply get out for a walk. Exercise is great for a 14-week fetus. Typically, there isn't a 14-week ultrasound. You likely had an ultrasound in your first trimester and won't have one again until the mid-pregnancy ultrasound, which usually happens between weeks 18 and 22. At 15 weeks pregnant, baby is as big as a navel orange. The average 15-week fetus weighs 2.5 ounces and measures 4 inches, and the baby's proportions becomes even more normal. Symptoms of 15 weeks pregnant. Here's a bit of what you might be experiencing at 15 weeks. Nosebleeds. This is due to the combination of increased blood volume and sensitive nasal passages. Heartburn, gas and indigestion. These tummy troubles are due to the hormonal changes. Pay attention to the food that are triggering your symptoms and try to avoid them. Swollen gums. Your gums are more sensitive now that you are pregnant. Take extra good care of them. Brush your teeth often and floss gently and see your dentist for regular checkups. Shortness of breath and increased sex drive. Your 15 weeks pregnant belly is making a big transition. During the first trimester, your uterus still fits nicely inside your pelvis. but now it's stretching to accommodate your growing baby and will soon outgrow your pelvis and sit higher up in your belly. Amniocentesis is another elective test. It happens between weeks 15 and 20. This invasive test can diagnose neural tube defects, chromosomal abnormalities, and other genetic disorders. It is considered safe overall but does pose some risks, so talk it over with your doctor to decide whether or not you will have this procedure. You may choose an amnio if you have an abnormal triple or quad test, or if your baby has a higher risk of genetic abnormalities. For the amnio, the doctor will use the ultrasound to see inside your 15-week pregnant belly and will guide a needle into the amniotic sac to gather a sample of fluid to be tested. At 16 weeks pregnant, baby is in the size of an avocado, measuring 4.6 inches long and weighing at 3.5 ounces. Symptoms of 16 weeks pregnant. Here is more of what you might be expecting at 16 weeks pregnant. Backaches. Your aching back is a side effect of pregnancy hormones. To ease backaches, make some time for low impact exercises. Sit and stand up straight and regularly stretch your body. Constipation. Constipation is an unfortunate result of your uterus starting to press on your intestines. Forgetfulness. This is also known as pregnancy brain. No one knows for sure what causes pregnant women to become more forgetful. It could be biological, or it could be just a result of having lots on your mind. Dry, itchy, sensitive eyes. Blame the hormones once again. You could try over-the-counter eye drops, but be sure to consult your OB before choosing one. Glowing skin. Finally, the pregnancy glow that people are always talking about. You will start feeling baby moving around in at your 16 weeks. At first, those moves might feel like a gas, but over time, as baby gets bigger and stronger, they will be unmistakable. You will probably have a 4-month prenatal visit around the time you are 16 weeks pregnant. As usual, you will likely to have a urine test. Your OB will be checking your urine for the signs of gestational diabetes and preeclampsia. You may have a 16-week pregnant ultrasound at your appointment too. A baby at pregnancy week 17 is in the size of a pomegranate. Your 17-week fetus is about 5.1 inches long and weighs about 5.9 ounces. Symptoms of 17 weeks pregnant. When you are 17 weeks pregnant, symptoms are most commonly due to your rapidly growing baby. Here is what you're likely feeling this week. Increased bodily fluids. Vaginal discharge, sweat, mucus and other fluids are in full force because of your increased blood flow. Weird dreams. Having strange dreams might be caused by your hormones. Itchy breasts and belly. As baby is growing, your skin is stretching thinner and can be more sensitive. Resist the urge to scratch and find a soothing cream that eases the itch. More rapid weight gain. You may have gained about 5 to 10 pounds by now. It's normal to gain about 1 to 2 pounds per week in the second trimester. Sudden or excessive weight gain could be a sign of a problem though, so talk to your OB if it's higher than that. Stretch marks. As you are putting on some pounds and your uterus continues to expand, getting some stretch marks might be inevitable. It is different for every woman. Drink lots of water to stay hydrated and use a good quality moisturizer to try to combat them. You may have a 17 weeks pregnant ultrasound if you have opted to have a cordocentesis. In this procedure, umbilical cord blood is tested for the signs of chromosomal abnormalities. The doctor uses an ultrasound to find the place where the cord meets the placenta. That's the spot where they need to remove the blood. Typically, this diagnostic test is performed after 17 weeks. It might be used if the amniocentesis results were inconclusive. At 18 weeks pregnant, Baby is as big as an artichoke. Baby is about 5.6 inches long and about 6.7 ounces now and keeps growing quickly. Symptoms of 18 weeks pregnant. Here is a scoop on the 18 weeks pregnant symptoms you might be feeling. Swollen feet and hands. Swelling can be an annoying pregnancy symptom. It's nothing to worry about as long as the swelling isn't sudden or severe. Backaches. Varicose veins. These visible purple or blue veins are swollen due to all the extra pressure on your circulatory system. To deal with them, change positions often. Prop your legs up when you can. Get plenty of exercise and avoid tight clothes and shoes. Trouble sleeping and nosebleeds. Increased pressure on the veins in your nose may be making it bleed more than usual. If you have a nosebleed, apply pressure by pinching your nose for 5 to 10 minutes. An ice pack can also help to stop the bleeding. Whether you are 18 weeks pregnant with twins, triplets or a single baby, you are probably feeling not just tiny flutters but more definitive sensations resembling actual kicks. At 18 weeks pregnant, the big ultrasound is on your calendar for some time in the next few weeks. The mid-pregnancy ultrasound is a detailed examination of baby's entire body. Your 18-week fetus will be measured to make sure that their growth is on track. Major organs will be checked for proper development, and the amniotic fluid, placenta location, and the fetal heart rate will be examined as well. Baby is as big as a mango at 19 weeks of pregnancy and about 6.0 inches long and weighing in about 8.5 ounces. Symptoms of 19 weeks pregnant, and those include abdominal aches and pains, dizziness or lightheadedness. Lightheadedness during the pregnancy can happen because of your growing uterus puts pressure on your blood vessels. And also the baby is crowding your lungs, so there is less oxygen for you. But there are also other things that can contribute to lightheadedness, and those include dehydration and hunger, so take care of yourself and eat and drink regularly. Leg cramps. Extend your leg and flex your ankle and toes towards your knees. Hip pain. If hip pain bothers you at night, try sleeping on your side with a pillow between your knees. Your 19-week fetus is developing a protective coat over their skin called vernix caseosa. It is greasy and white, and you may see some of it at birth. Baby at 19 weeks is also working on their 5 senses. At 20 weeks pregnant, baby is in the size of a banana. They weigh about 10.2 ounces and measure about 6.5 inches from crown to rump. Starting next week, baby will be measured from head to toe. Symptoms of 20 weeks pregnant. As symptoms from the previous weeks continues, a new symptom, shortness of breath, starts. As your uterus expands, it pushes against your lungs and causing you to feel short of breath. You might find this to be especially true if you are 20 weeks pregnant with twins. Starting around 20 weeks pregnant, your doctor will measure fundal height at each prenatal visit. Fundal height is the distance from the pubic bone to the top of your uterus. In centimeters, the fundal height should match your week of pregnancy, with approximately 2 centimeters more or less. For example, your 20 weeks pregnant belly should measure around 18 to 22 centimeters. It should continue to increase about 1 centimeter each week. At 21 weeks pregnant, baby is as big as a head of endive, with 10.5 inches long and about 12.7 ounces. Symptoms of 21 weeks pregnant. As the symptoms from the previous weeks continues, new symptoms like leaky breasts and Braxton Hicks contractions start. Your milk duct will be fully developed by the end of this trimester, just in case of an early arrival of the baby. Braxton Hicks contractions. Your uterus might occasionally feel tight as it practices for labor. This is totally normal as long as the contractions go away when you switch the positions. At 21 weeks, fetal movements are noticeable, and the baby has reflexes too. If you gently press your palm on your belly, you might feel a little push back. At 22 weeks, baby is in the size of a coconut. The average baby size is 10.9 inches long from the crown of the head to the heel of the foot and 15.2 ounces. These are the most common symptoms seen in the 22-week pregnant. The baby sleeps in cycles, about 12 to 14 hours per day. If you haven't had your mid-pregnancy ultrasound yet, this is the week. This 18 to 22 weeks pregnant ultrasound gives you a glimpse of all the body's major organs and other body parts. At 23 weeks pregnant, baby is as big as a grapefruit. The average 23-week fetus measures 11.4 inches from head to toe and weighs 1.1 pounds. The symptoms of the 23 weeks pregnant are similar to the previous weeks. At 24 weeks, baby is in the size of a cantaloupe. Your 11.8 inch fetus now weighs about 1.3 pounds. Symptoms of 24 weeks pregnant: as swollen ankles and feet, leg cramps, backaches and stretch marks continues. New symptom, linea nigra starts. Linea nigra, that's the dark line that runs up the center of your belly. Influenced by the pregnancy hormones, the linea nigra should fade within few weeks to months after giving birth. Around 24 weeks pregnant, your doctor will order a glucose challenge screening test, one of the most important prenatal tests, to see if you are at risk for gestational diabetes. The test is designed to see how your body processes sugar. So you will be asked to drink a sweet liquid and the blood is drawn after 1 hour. And then it will be tested to see how your body has processed the sugar. If your doctor finds abnormal results, you will have to have a follow-up test called the glucose tolerance test. It will measure how your body processes sugar over the 3-hour period to see if you really have gestational diabetes. Fetus at 25 weeks is as big as a head of cauliflower, measuring 13.6 inches in length and weighing nearly 1.5 pounds. At 25 weeks, new symptom hemorrhoids start. Hemorrhoids are common in the second half of pregnancy because baby is putting a ton of pressure on your digestive tract, and the constipation certainly isn't helping. Getting the constipation under control will help to prevent straining while you go to the bathroom and hopefully will prevent for further swelling and discomfort. It is not likely that you will get an ultrasound at 25 weeks pregnant unless your doctor has ordered extra monitoring for your baby. At 26 weeks pregnant, baby is as big as a head of a kale. Your 26-week fetus measures about 14 inches in length and weighs about 1.7 pounds. At 26 weeks, a new symptom, high blood pressure, starts. A slight boost in blood pressure is normal at 26 weeks pregnant. A systolic reading of more than 140 mm mercury or diastolic reading of more than 90 mm mercury could be a sign of preeclampsia. These potentially dangerous pregnancy complications would need to be addressed right away. At 27 weeks pregnant, baby is as big as a head of lettuce. The average 27-week fetus measures 14.4 inches length and weighs 1.9 pounds. At 27 weeks, a new symptom, sneezing, starts. Sneezing. This is what we call peeing when you sneeze. Baby is putting a ton of pressure on your bladder and there is not much you can do about it except taking frequent pit stops to empty your bladder. If your pregnancy has been uncomplicated so far, you probably won't have a prenatal appointment or a 27-week pregnant ultrasound. Thank you for watching. Hope you guys like this video, and please do like, share and subscribe.